Thank you.
Thank you for, yes. Hi, everyone. Good morning. And really thank you to the organizers of this excellent conference for the opportunity to present some of the work that we are doing at the Africa Centers for Disease Control and Prevention. And really sorry for not being there in person. It's been an excellent opportunity to meet everyone and discuss, more. And thank you to Prof. Bloomberg really for an excellent presentation that really sets the stage, for what I'll be presenting on today. So just to give a bit of background, the Africa Centers for Disease Control and Prevention, or Africa CDC, is now what we call an autonomous health institution of the African Union, and was established to support public health initiatives of member states and strengthen the capacity of their public health institutions to detect, prevent, and control, and respond quickly and effectively to disease threats. And we've had this autonomy for a very short while now. And while it means that our financial and administrative procedures are changing, it also means that Africa CDC now has the legal, institutional, and operational autonomy to serve as a channel to mobilize finances and build the necessary capabilities required, as well as some of the vital continental assets for disease prevention and control. We can also make decisions in case there is a need for an urgent response of deployment of resources to fight disease. And we are now definitely more accountable to our member states. So Africa CDC's work is really anchored on a set of clear objectives that really, have been thought out to fit around preparedness and response for emerging and re-emerging diseases. And these, as you will see on the objectives, I'm not going to read all of them out, but you see, for example, objective 1 is right on spot to establish early warning and response surveillance platforms to address all health threats and natural and health emergencies and natural disasters in a timely and effective manner. I'm just going to go quickly here. Here we go. So we've heard an excellent intro from Prof. Bloomberg earlier, but really infectious diseases remain a great threat to Africa's aspiration to achieve the African Union Agenda 2063, the Africa we want. Health as a development issue continues to have a significant impact on the economic and social security of countries and regions across Africa. And Africa's underlying burden of endemic diseases is the largest in the world. So infectious diseases play a particularly severe role on the continent, and every year they account for over 227 million years of health life lost and produce an annual productivity loss of over 800 billion USD. And moreover, these outbreak-prone diseases are an increasingly devastating force, and of the estimated 10 million deaths per year resulting from infectious diseases, the majority occur on the continent. So Africa finds itself balancing its developmental aspirations with strengthening the health systems to help it fight concurrent epidemics, which is what we call the syndemics. It is really faced with a set of linked health problems that interact synergistically and contribute to excess burden of disease, rising rates of NCDs, which, as we know, really becoming a huge problem on the continent. And we saw that during COVID very clearly, emerging and re-emerging infections, endemic diseases. And this syndemic is the result of 5 major factors: rapid population growth on the continent, widespread infectious disease, including endemic diseases such as HIV, TB, and malaria, which together account for more than 1.2 million deaths per year on the continent, emerging infectious pathogens, and the rising prevalence of antimicrobial resistance, which can cause up to 4 million deaths, which is estimated to cause up to 4 million deaths by 2050. Increasing incidence of NCDs and injuries, and persistently high maternal mortality rates, and threats posed by the environment, climate, and ecological changes. And really, these are aptly summarized, in these figures, in this diagram. I hope that you can see it quite clearly. But really, we're looking at, the major contributing factors of emerging and re-emerging diseases, which are very relevant to the African context. More and more, as we've heard from Prof earlier, there's, urbanization, and hence, encroachment on the territory of wildlife. There's ongoing wildlife trade and consumption, even as we are getting more industrialized. There's more migration from areas of conflict and natural disasters, but also from the African continental free trade area, which promises free movement of goods, free movement of people, and by extension, free movement of diseases. We also have to think about climate change, which is really increasing the habitat of, different vectors, such as mosquitoes. And now we've seen, an increase in malaria due to introduction of other malarial vectors, such as Anopheles stephensi, initially only found, they were only detected in the Horn of Africa, where there was an increase in malarial cases after they were detected, but also now in 2020 they've also been detected in Nigeria. And as we know, this stephensi is a very proficient vector in urban areas. And of course, when we think about, Prof has said, we don't always think about, AMR, so antimicrobial resistance, as an issue, as a re-emerging disease. But as we are utilizing more and more antibiotics, we are seeing, drug resistance arising from, nosocomial infections, definitely, but also from diseases that have been there. So even HIV, even, TB, you see more and more cases of, multi-drug resistance, for example. And the result of these factors are clear. So this map shows re-emerging in other diseases that were reported to Africa CDC in the first 8 months of 2020 alone. And you see the sizes of the circles correspond to the number of imported cases. And of course, since then, we've had we had COVID, we've had Mpox go global, and we've recently had Marburg as well in countries that have never reported this disease before. We are seeing more and more cases of vaccine-preventable diseases, such as measles and polio. And with COVID-19, really, the progress that we've made on HIV/AIDS, on malaria, on TB has stalled, certainly. But really, I think, the progress fighting these diseases was already plateauing before COVID-19. So really showing that, we cannot carry on with business as usual. Things have to change for us to be able to fight these diseases sustainably on the continent. So from COVID-19, really, a worldwide pandemic, emerging disease, came our greatest lessons, including that for the need to invest sustainably in our healthcare system on the continent. And these lessons were distilled by our fierce leader of then, Dr. John Nkengasong, and the team at Africa CDC into what is now commonly known as the New Public Health Order. And the New Public Health Order is really Africa CDC's roadmap to sustainable health outcomes and health security. It is defined by 5 pillars, and I will mention some key initiatives that Africa CDC is conducting under each pillar. So the first one, you have the strong African public health institutions that represent African priorities in global health governance and that drive progress on key health indicators. So we really need to make sure we're strengthening our national public health institutions, including our national public health, including, the different, institutions that we have, at continental level, but also, institutions like Africa CDC, to really be better prepared to face these diseases, and not just face them, but first face them early enough. And the disease threats that have been mentioned earlier, really highlight the importance of having an integrated surveillance and laboratory network, because diseases have no borders. They are unhampered by country borders, and they should really be tackled from a regional perspective. And this is where one of the key flagship programs of Africa CDC, which is ResolNet, the Regional Integrated Surveillance and Laboratory Network, comes into play. This network really aims to link up existing assets and human resources at regional level to solve common priorities of the region. So it really advocates for public health information and data sharing between countries, strengthening of cross-border surveillance, implementing and improving sample referral and transport systems to enable timely diagnostics of diseases of public health concern. And this has really been done, quite well during COVID, but really how to make sure that, these systems that have been placed for COVID now are, being used for other, diseases, other priorities within the region. And of course, recognizing the importance of public health emergency operation centers in responding to emergencies, Africa CDC has been supporting these national EOCs, public health EOCs to either to be established or strengthened. And this support includes ICT equipment, information systems, infrastructure development and training, technical training to really operationalize these public health EOCs. And we've supported Burundi, Malawi, South Sudan, Uganda, Zambia, and Zimbabwe in 2022 alone. We also had the Lusaka call to action to strengthen public health EOCs in Africa, and we launched that. And this call seeks to accelerate establishment and or strengthening of these public health EOCs in all AU member states by 2026. We also have a vibrant One Health program, and that has an excellent framework for NPHIs that I really encourage all of us to consult. It's available on the Africa CDC website. And last year alone, Africa CDC provided technical support to 8 AU member states, 2 regional economic communities, and partners to build their One Health capacity following, this framework. And this year, one of Africa CDC's flagship initiatives, which is a digital solution to manage and track public health threats. So the event management system, the EMS, was developed and deployed in 3 AU member states. The system is supporting the AU member states in the capturing, tracking, and analysis of structured and unstructured data to improve early warning and response. Another important pillar is expanded local. The second pillar now is expanded local manufacturing of vaccines, diagnostics, and therapeutics. And I think this was one of the points that Prof. Bloomberg mentioned earlier. And really, we need that to increase access to life-saving medicines and equipment. And Africa CDC held the first African vaccine manufacturing conference during the pandemic. And subsequently, the Partnerships for African Vaccine Manufacturing, or PAVM, was established by the African Union in 2021 to deliver on quite a bold goal to enable the African vaccine manufacturing industry to develop, produce, and supply at least 60% of the total vaccine doses required on the continent by 2040, which is going to be a massive improvement from less than 1% that we are seeing today. And to meet the 60% target set by Africa CDC, really we will need 1.5 to 1.7 billion doses to be produced locally on the continent. And we've prioritized 22 diseases to achieve this target. And these include diseases that have outbreak potential that are very relevant for the African health agenda, such as Ebola. We've also supported development of vaccine for diseases that have outbreak potential and for which, there's no vaccine available to date, such as Lassa fever, chikungunya, and of course, pathogen X or disease X when it comes. And really, Africa CDC's focus of work in this area is human capital development. And we've supported training of experts on vaccinology in partnership with the International Vaccines Institute. And we've also established a research and development center for vaccines manufacturing at the Institut Pasteur in Dakar, Senegal. Of course, we cannot talk about, investing in manufacturing without thinking about our workforce. This is a key component of everything that we do. We need to invest in our public health workforce, and we've really put together, several leadership programs to really strengthen and incapacitate our healthcare workers on the continent. We've got several leadership programs in place, such as the Kofi Annan Fellowship, which really aims to enable fellows to acquire advanced skills and competencies to strategize, manage, and lead public health programs that will positively transform public health, in Africa. We also, of course, support the field epidemiology training programs across the continent in both Anglophone and Francophone countries. In addition to, leadership programs, we also have a really strong community healthcare worker program. And we believe that, this is the program that will really bridge, the gap between the healthcare facility and the community. And already, you see community healthcare workers providing health education on WASH, on health-seeking behaviors, including immunization. And they are the ones that are really supporting the hard-to-reach areas, which is usually where the outbreak cases, are spotted. So these community healthcare workers can also be trained on what we call event-based surveillance and really report signals in the community, such as sudden deaths of animals or cluster of people dying from, hemorrhagic fevers that can then be further investigated by the local authorities. And to strengthen the capacity of member states to evaluate their capabilities and capacities to detect and respond to public health emergencies. We've also trained experts on the continent in public health simulation exercises, and also to conduct intra-action and after-action reviews. And we also monitor ongoing outbreaks on the continent. We've deployed rapid responders and community healthcare workers to handle all outbreaks that for which we've received requests for help, including the Marburg and Mpox outbreaks. I also want to mention the genomic sequencing. We've got an excellent program on genomic sequencing, and we believe that this technology can provide the scientific evidence needed for health systems to better prevent, identify, and track outbreaks, to really help public health experts stay ahead of novel pathogens and re-emerging diseases. And Africa CDC's Pathogen Genomic Initiative, the PGI, is really working to expand genomics and bioinformatics capacity in NPHI and reference laboratories on the continent. A total of 11 trainings were conducted for public health, and 213 laboratory personnel from 51 member states participated. This was in 2022 alone. And these trainings include sample referral, molecular testing, data analytics, and bioinformatics analysis, because as we know, it's just not useful to actually test and have the data. We need people to be able to analyze the data for concrete public health action as well. And I also want to make special mention of the fact that as much as we're developing these, we're also looking at the mental health component, which we think is incredibly important in the response, both to protect our first responders, our rapid responders, but also to support the people that that they are supporting during these outbreak response. Another pillar is the increased domestic financing. We really need increased domestic investment in health, including domestic mobilization of financial resources, human capital, technical resources, and networks. And we're really advocating as Africa CDC for domestic financing, pooled procurement. We have the Africa Medical Supplies Platform for that, integration mechanisms to really ensure more health per dollar invested. And we are advocating for integrated approaches to maximize service delivery, really make the most of our existing workforce. And also, when we talk about domestic financing, it's not just government investing, but also looking at the private sector within countries and how they can support the public health agenda on the continent and nationally as well. And to end, I want to talk about a very important pillar, which is the respectful action-oriented partnerships, really to advance vaccine manufacturing, health workforce development, and to have strong public health institutions. We've renewed partnerships with several organizations with massive investments, really to ensure that we're enhancing the capacity of Africa CDC as an African institution, as your institution, and really to be able to support member states better in preventing, detecting, and responding to current and future public health threats. We've also created forums such as the second Conference on Public Health in Africa, CPHIA, which takes place at the end of the year. Last year, it was in December. It took place in Kigali, Rwanda. And that was the first in-person edition. And that was under the theme, Preparedness for Future Pandemics and Post-Pandemic Recovery, Africa at a Crossroads. It was really a unique, and it will also take place at the end of this year in November. It's really a unique platform for leaders, researchers, policymakers, youth, and other stakeholders from Africa and beyond to share scientific findings and public health perspectives, including creating new collaborations for innovations across the continent. And I want to end by mentioning that, we also, as Africa CDC, one of the main things we do really well is really convening. We have, very strong convening power. So we've really convened, ministerial meetings, for example, on AMR and we've done that last year. We've done this AMR advocacy during the World Antimicrobial Awareness Week in collaboration with the quadripartite organizations and the government of Senegal in Dakar. And we provided technical support to AU member states, RECs, and partners to really build their capacity across the One Health framework that we have. So really thank you for your attention. This was really a snapshot. I want to say there's so much that we're doing as Africa CDC, and I'm really pleased that I've been given the opportunity to present on it. And I'm happy to answer any questions afterwards. Thank you.